Welcome to Cape Town and the 34th Congress of Internal Medicine. We're very fortunate to begin this series of programs with Dr. Adri Kok, who is the chair of the organising committee and the lady who's really made all this happen. Adri, you must be so proud and so happy that this Congress that you've been working on for so many years is actually happening today.
It seems a bit unreal, Mike, if you look at it. We started planning for this about 8 years ago in 2010 when we first bid for the Congress in Melbourne. And then in Chile in 2012 we were successful. And I'm happy to report that we have 84 countries attending. We have speakers from numerous countries, and as many of these people that we've invited, there's only been one person that couldn't come because of health reasons. And to me, that's really a significant fact that people were willing to come to South Africa. They were excited about Cape Town, and they looked at the program and they really were happy to see that so much of internal medicine was being covered.
Am I right, this is the first time this very, very important Congress has ever taken place on the African continent?
We were very delighted that we received this bid. It had never actually been tried to bring it to South Africa or to Africa as such. And it was really, I think it was kudos for South Africa that they accepted our bid and that they thought that Cape Town would be a good venue to have this and to host this amazing conference. So I think we really are in a place where people would love to come and visit. They've heard a lot about South Africa. Many have visited South Africa before. And when you talk about Cape Town, their eyes light up. So it's wonderful to have this opportunity.
Who can blame them when you see views
Absolutely.
Like this?
For sure.
Why is it so important for internal medicine and for Africa that it's held here?
If you look at medicine around the world, the general physician is it's a person that's really disappearing in many countries. It's becoming very specialized. But unfortunately, as much as there's specialization, there's a significant amount of where the general physician actually is the person that needs to coordinate care.
And what do you hope a delegate attending the conference is going to go away with?
Well, the first thing I hope is that they must be completely confused about what to attend. So they must sit and wonder, okay, I'd like to go and listen to this guy. Oh, no, what about this one? So we've made available a voucher so that you can access all the lectures for a year afterwards on the web. You'll have a specific registration number, and you'll also have CPD points for those lectures that you'll be looking at. And what we've tried to do is to really ensure that we cover all the aspects of internal medicine, and that would be an encouragement, especially to young doctors. So we've tried to involve as many young doctors as we can. We also have some students attending and some nurses as well, because we feel that there's really you need to encourage people to look at this as a possible area of specialization. And if you are a specialist, an existing specialist, to continue to improve your education, to really be up there with the best in the world. Because I still think from South Africa, we have an influence in Africa that we should be exerting on a much higher level. And we hope that this is a good starting point and a platform to work from.
If I may, on behalf of the more than 2,000 delegates that you've brought to Cape Town, I'd like to thank you for providing us with such a wonderful program to look forward to in the coming days. And also, if I may, I'm going to invite you back at the end of the conference to tell us how it went. Adri, thank you.
Thank you very much, Mike. And I hope that every person that have come to Cape Town to enjoy this conference will have a fantastic time, that you'll have some time to interact with colleagues, enjoy the beauty of Cape Town, and I hope that the academic program really delivers as we've intended. Thank you very much.
Thank you.